Oh, kia ora tātou. Just wanted to record my slides for the Māori experiences of rehabilitation from major trauma project. Ngā mihi nui kia koutou katoa. Ko wai ahau, ko marotere te maungi, ko maunga hawa ni te awa, ko tuatini te marae. Whanau ro te pare te hapu, ko ngā te porau te iwi, ko harau te waka, ko Sharon Pihema tōku ingoa. Tēnā tātou katoa. So kia ora everyone. I just thought I would do a follow-up video on the slides that I had for the presentation. And so I won't cover everything in the project. Everything's in the report, and there's a link on the final slide that takes you to that report. So yeah, feel free to get all that other information from there. But basically this was the research question that we were asking, which is, what was the experience like for whānau Māori undertaking rehabilitation from major trauma? And yeah, this slide here is just giving some data on our participants. We did a very whānau inclusive process throughout it all. So once we had identified people that were eligible to be interviewed, we left it up to them to decide how they wanted to be interviewed, whether it was on phone, on Zoom, tānohi ki te tānohi, so face-to-face interviews. We let them decide whether they wanted to be interviewed by themselves or if they wanted to have other whānau members, friends, whoever. That was up to them to decide. And yeah, even we went in there with, we didn't have set questions. We had discussion prompts if we needed them, but often we didn't need to use them because whānau just kind of shared their story willingly anyway. But we let them decide how much they wanted to share with us, what they wanted to share with us. And then whatever information they did give us, we then came back and analysed and went through all of that to find the common themes. Yeah, so you'll see there the age at the time of the injury. So we had a bit of a mix there. And then the injury mechanism. So the majority of people that I interviewed had been injured in car crashes. So these next slides are just, I just pulled out kind of the main recommendations that for me, having interviewed everyone, they were the ones that kind of jumped out at me the most. And then the actions that go alongside it. So the first one was around whakawhanaungatanga. And this was across every single interview that I did with whānau. And so that box on the left, all the negative kind of experiences that they had, this is what they talked about. So they talked about being frustrated, about being judged, about not being heard, the mental struggle, the mental, the impact that it had on their mental health, and the impact that it had on their emotional well-being as well. A lot of them found it really hard to maintain a healthy mindset when they didn't have that relationship or that connection with the people that were looking after them. Then caused them to become disengaged in the whole process. That then impacted on their recovery rates, and then they were kind of left throughout the whole, you know, through the other end of it, just having that mistrust in the system and feeling let down by it all. Whereas when I talked about it with people that, you know, had positive elements or positive experience in terms of the rehabilitation and recovery, these are the things that they talked about. So they felt like they were engaged in their recovery. They had confidence in their care team. There was a deeper understanding of each other. So there was that mutual respect, that common ground, that shared understanding between the two, between themselves, their whānau, whether it was the doctors, the surgeons, the nurses, the case managers, wherever they were, whatever part they were in terms of their recovery. If the whakawhanaungatanga had been done really well, then they had that mutual respect and shared understanding. Whānau talked about feeling comfortable to ask questions, and that they were part of the discussions and decisions around their care, which you would think would happen automatically, but it didn't in a lot of the people in a lot of these interviews. So yeah, feeling valued, feeling part of a wider group. And it was really quite interesting because, yeah, for those whānau that had negative experiences around whakawhanaungatanga and that they weren't given that opportunity to develop a relationship and build trust with the care team overall, they talked about their experience in a really negative way and just how hard it has been for them to recover. Whereas those who had positive experiences with whakawhanaungatanga came out the other end of it in a really good headspace. They knew that they would get to a point in their recovery in terms of what they were aiming for, what their goals were, the different strategies that they would have to help them in their recovery. Those sorts of things came through quite strongly. And so the recommendation that we came to in terms of whakawhanaungatanga was to please make it a priority for all health and social service providers. So yes, while they're, at every single point of that recovery journey, there are opportunities there to develop and nurture whakawhanaungatanga. And that's just a quote up the top there from one of the tāne that I interviewed, that the only person that gave him a handshake and introduced themselves was a student surgeon, which is really disappointing. And so the action there was around clinicians practicing whakawhanaungatanga with Māori patients in whānau. And so there are lots of ways and lots of opportunities to do this. And please just give it a go. We do it in other parts of our lives every single day. If you think about it in terms of when we are, when we've got to take the kids to school, when we're talking to other parents, when we're at a barbecue, when we're at a wedding, when we're at a conference, and we're having to be in those spaces where we make small talk and get to know strangers. Those are all those skills that we need to bring into the clinical space in terms of creating that whakawhanaungatanga with our Māori patients and our Māori whānau. So this was the second theme that kind of came through quite strongly as well, was the psychological and emotional stress on people after they had been injured. And it looked different with different parts in their recovery. So their psychological and emotional needs while they were in hospital were very different to their needs once they had been discharged and were sort of post-discharge 1 week, 1 month, versus what space they were in 6 months, 12 months, 18 months after their injuries. So they talked about this area a lot, and they talked about things like what I've listed there: the loneliness, the loss of independence, work pressure. So that kind of came through from some of the younger ones, where they felt pressured to return back to work once ACC kind of put a date that they had to be recovered by or had to return to work, and them knowing that they weren't fully recovered or fully healed, but feeling pressured to hurry up and get there because they had this return to work date on their file. They talked about the ongoing problems with their injuries, so things taking longer to heal or not, just not fully understanding the extent of their injuries, which kind of jumps back into the whakawhanaungatanga, when if the person didn't have a good relationship with their doctor or their surgeon, so there was never that opportunity to have a good kōrero about their injuries and what the plan was and to work on that plan together, that then kind of flowed into whether their recovery and the ongoing problems that they had with their injuries would persist. As I mentioned before, mental health being more difficult than their physical injuries. So they all talked about this. They knew their physical injuries were serious. They knew that they were painful. They knew that it would take a long time to recover from. but they could cope with that. What they couldn't cope with and what they found really challenging was just how hard it would be on their mental well-being, and that was often more harder to cope with than their physical injuries. They talked about things like the pressure on their relationships. A few of them had relationship breakdowns as a result of their injuries and the stress of rehabilitation on that relationship. And the financial barriers, housing pressures. So those two were talked about more with the younger ones. And by younger, I kind of mean 25 years down. So between 18 and 25 years. Because it was, if you think about it, these are our rangatahi, our young people who are just getting into adulthood. So whether they've got stable employment, whether they've got secure housing, whether they've got a steady income, if those things weren't in place at the time of their injuries and at the time of their accidents, it just made everything so much harder in terms of in their recovery and their rehabilitation, and then being able to access the financial, social, housing support that they needed. And there was an example there of one young wahine that I interviewed who was, I think, 19 at the time of her injuries from a car crash, and she found herself homeless and sleeping in her car with fractured legs because no one would help her. It was that was like just one of those kind of stories that stuck in my mind throughout these whole interviews. Some of them talked about how they were never offered psychological support. So when I asked that question, they asked me, well, what's that? What's a psychologist? And it's amazing to think that they've gone through that whole process with really serious injuries and a really long rehabilitation and not being offered any psychological support whatsoever. Some of them are still waiting for a counsellor, kind of 1.5 to 2 years after their accident, their injuries. And being frustrated at that. And then some of them talked about their the sort of suicidal thoughts and ideations that they had during their recovery as well, and that had gone unchecked as well throughout their rehabilitation. So they kind of just figured, except for one young wahine, the other ones just figured out their own way through that. And the one wahine that I mentioned before, she was able to get counselling support to help her through that. But they had all got to that point where they had put a plan together, and they were literally just days away from committing suicide. Anxiety, depression, yep, they talked about that quite a lot. A lot of them were still struggling with that. And then the PTSD, and that was most notable in those that had been injured in car crashes, and really quite impacting on their everyday life. If I can move this one down. So this was a quote from a young wahine that was injured in a car crash around how hard it is for her to drive with anybody else in the car unless she's driving. And I guess we just kind of don't see that impact because this is their way of coping with it by themselves. And so the recommendation that came from that was that health and social service providers assess, monitor, support psychological and emotional well-being of patients in whānau. And we put and whānau in there as well because there were stories that they shared with us around the impact that their injuries or their accident or the whole traumatic event, the impact that had on the wider whānau. And there are examples there where, especially in car crashes, where other family members had been injured or other family members had found the car crash and had to go be the first responders and go call 111. And that happened for one young wahine, and it was her younger brother who had to go and do that in a rural, it was rural, it was the middle of the night, it was dark. the nearest house was half an hour away and he had to go and run to get help. And he never got any support for that. So yeah, that providers routinely screen all Māori major trauma patients for clinical signs of pain, PTSD and concussion, with whānau engagement and referral as appropriate. And then the second action there, all health and social service providers are, where feasible, encouraged to assess the well-being of patient and whānau using a hauora Māori model. And yes, I go back into the report because there's a lot more detail around that action as well. So support for the whānau. This one came through really strongly for me as well, was just how much support we need to give for whānau so that they can then support their loved one to be able to recover. So, you know, when I asked people what was the one thing that helped the most in their recovery, they all said their whānau. Their whānau was their number one thing that helped them during their recovery, and that they wouldn't have been able to get through it without that whānau support. And we need to acknowledge that, and we need to give more mana to that, because that's an essential part of a positive recovery and rehabilitation experience. And so, you know, whānau provide all of that holistic support, all of that aroha, manaaki and tautoko to that person that nobody else can provide. But it does, there is a heavy burden to it, and it does come at a cost. Whānau members talked about how it was hard to balance caring for their loved one with their full-time jobs, with their day jobs, with looking after their own children, or the person that's been injured, looking after their children, having to get to the hospital every day to look after them, and all the costs associated with that around petrol and parking and food, and then the emotional burden. And so when they did try to reach out and find some support, it wasn't there for them. One husband talked about how nobody in the hospital ever asked if he was okay or what did he need. Everything was focused on his wife. And we understand that, and that's kei te pai, but nobody ever took the time out to ask him if he was okay. Hang on, I'll just move this down a bit. And so this quote here was from another young wahine that I interviewed who had been injured in a car crash, whose partner had couldn't cope with the stress and the pain of seeing her in pain when she was in intensive care. And so he turned to drugs and went back on them, and there was no one there to support or help them through that. And so obviously the recommendation there is around agencies getting involved in providing that support for whānau. That action there, that all agencies working with major trauma patients and their whānau, including regional trauma networks, use a consumer whānau panel to inform service development. When I interviewed whānau, they were really motivated to be involved in this project and to be interviewed because they didn't want other whānau to go through what they had gone through. And they wanted to share their story back to us, back to the workforce, so that we would know the areas where we could make improvements the most. And so they were all, you know, a few of them were keen to go to that next level and become involved in any kind of advisory capacity or consumer panel that would help continue those quality improvements. So if, you know, my suggestion would be, if you have whānau within your networks, within your patients, within your kind of settings who are keen to do that, absolutely tap into them, because they will tell you what works, what doesn't, and what to do better. And so this was my final slide. This was a quote from a queer that I interviewed down in Otautahi, Christchurch. And so she left our interview with this quote: "It's not new to you, but it's new to us." And that was in the recognition that while doctors and surgeons might do, you know, have done 1,000 hip operations or whatever, that all of this is brand new to them and they've never had to go through it before. It's scary for them. It's uncertain. They want to be involved in the decision making. They want to understand everything that's going on. They want to be part of that that process. And so take the time to include them in it. Take the time to give them the time to be involved in it and to participate in it. Because yeah, when that happens, we just see overwhelmingly the positive impacts that has on their recovery and rehabilitation outcomes. So yeah, those were just a quick overview of some of the slides, and there's the link to the full report there. Kia ora koutou.